Good day, and welcome to my mini workshop about the virus that has taken over the world and is on everyone's lips. COVID-19, also known as coronavirus. My name is Carlo Correia, and I'll be your facilitator for today's workshop. So before today's workshop, all the delegates were sent a training needs analysis via Google Forms to get a better understanding of their current knowledge of COVID-19. Based on their responses, I was able to identify a gap in certain areas. So for today's training, we will be focusing on those areas and touching on areas that have most recently been amended, as well as additional areas that through my experience people are unsure of. So, without further ado, let's jump into it. What is COVID-19 and how is it affecting us? The World Health Organization explains that the coronavirus is a severe acute respiratory syndrome, scientifically known as SARS-CoV-2. It is a large family of viruses which may cause illnesses in animals or humans. In humans, several coronaviruses are known to cause respiratory infections, ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome, MERS, and Severe Acute Respiratory Syndrome, SARS. Around the 7th of January 2020, Chinese scientists confirmed a cluster of pneumonia cases that were identified in Wuhan, in Hubei province of China in December 2019, and were associated with the novel coronavirus. The World Health Organization Health Regulations Emergency Committee declared the outbreak a public health emergency of international concern on 30th of January 2020. South Africa activated its Emergency Operations Center, the EOC, on the 31st of January 2020. The human coronaviruses are common throughout the world. The name corona refers to the crown, because the viruses have a crown-like spikes on their surface when viewed under a microscope. COVID is able to survive on surfaces for a substantial amount of time. It can survive on copper for 4 hours, in the air for 3 hours, on cardboard for 24 hours, and on plastic and stainless steel for 72 hours. These are common items that we all have in our homes and workplace. Therefore, it is extremely important that we clean and disinfect our home and workspaces regularly. As per the Department of Public Service and Administration, with the first cases of COVID confirmed in South Africa, the President of the Republic of South Africa declared a national state of disaster. As per the Minister of Health, Dr. Zwelini Mkhize, the first case of COVID was a man in KwaZulu-Natal that arrived in South Africa from Italy on the 1st of March 2020. He flew via Dubai into King Shaka International Airport and travelled to home into Hilton. The man started showing his symptoms on the 3rd of March 2020, and both he and his doctor went into self-isolation. The Minister of Health made the statement that the man's symptoms were not severe. President Cyril Ramaphosa then declared a national state of disaster and a partial travel ban. President Ramaphosa announced that travel advisories and also discouraged the use of public transport. Schools closure were mandatory, and gatherings of more than 100 people were prohibited. Following President Ramaphosa's statement, Dr. Nkosazana Dlamini-Zuma, the Minister of Cooperative Governance and Traditional Affairs, designated under Section 3 of the Disaster Management Act 2002, declaring a national state of disaster, and this was then published in the Government Gazette number 43096 on 15th of March 2020. Following this declaration, the various organs of state. What are organs of state? The organs of state are any of the three primary divisions of a state's sovereignty, naming the executive, the legislature, and the jurisdictionary. The powers of each having been divided and balanced in accordance with the political principle on the separation of power. The organs of state instituted drastic measures to curb the spread of the virus. All schools were closed on Wednesday, the 18th of March 2020, and the country went into full lockdown on Friday, the 27th of March 2020. The lockdown was originally planned to go on for 21 days. However, due to the massive spike in confirmed cases, President Ramaphosa extended the lockdown for a further 2 weeks. The lockdown had a serious economic impact on businesses and schools within the country. Level 5 lockdown was lifted towards the end of April 2020. People were then allowed, with strict restrictions, to start a staggered process of going back to work. On the 1st of May 2020, President Ramaphosa announced that the country would go into level 4 lockdown, which eased some of the strict restrictions and now allowed some more shops to open and for some individual sports to be allowed to start. According to the IRL, they reported an article on the 6th of June 2020 stating that level 3 started on the 1st of June 2020, which marked a significant opening up of the economy and finally on the decision to reopen schools. Millions of South Africans were able to go back to work. The 1st of June 2020 was a glorious day for South Africans as the President announced that alcohol sales was open. But that victory was short-lived as the President banned the sale of alcohol again on the 12th of July 2020. As we eagerly await President Ramaphosa's next State of the Nation address, all we can do now is wait. COVID has affected millions of lives, and the only way we can beat this virus is to understand it. And in this mini workshop, we will be discussing different topics around COVID to help you better understand the virus and to safeguard yourself, your family, and friends, and prevent the spread of the virus. Let's have a look at the current statistics in South Africa for COVID-19. As at the 1st of August 2020, Corona Tracker provides us with the following statistics of COVID within South Africa. A total confirmed cases stand at 503,290 cases. Total recovered cases stand at 342,461 cases. And total deaths stand at 8,153. The current fatality rate is 1.6% of total cases and 68% recovery rate of total cases. Corona Tracker also stated that on the 1st of August 2020, South Africa confirmed a new 10,107 cases, 16,290 recoveries, and 148 deaths for the day. According to the World Health Organization, South Africa is placed 5th on the global scale, with the United States at the top of the list confirming 4,456,389 total cumulative cases and 151,265 deaths to date. Statistics is a really good tool for us to measure the current rates of infections, recoveries, and deaths. These statistics will assist us to see when our country has peaked and when the amount of cases starts to reduce. Information such as this is vital to us monitoring and measuring the spread of the virus in our country and around the world, to assist us with monitoring and regulating our country's different levels of lockdown. What are the stages and symptoms of COVID-19? The Center of Disease Control and Prevention, the CDC, explains that anyone can have a mild to severe symptoms. Older adults and people who have severe underlying medical problems such as heart, lung disease, or diabetes seem to be at a higher risk for developing more serious complications from COVID-19 illness. The CDC continues to explain that people with COVID will have had a wide range of symptoms. These symptoms can range from mild symptoms to severe illnesses. Symptoms may appear from 2 days before onset of symptoms to 14 days after exposure to the virus. Generally, people with COVID can display one or more of the following symptoms: fevers or chills, coughing, shortness of breath or difficulty breathing, fatigue, muscle or body ache, headache, loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. The CDC goes on to say that the above list does not include all possible symptoms. As per the Department of Health and the National Institute for Communicable Diseases Frequently Asked Questions list, they mention that some people become infected but do not develop any symptoms or do not feel unwell. Furthermore, the risk of catching COVID from someone with no symptoms at all is very low. However, many people with COVID experience mild symptoms. This is particularly true at the early stages of the disease. It is therefore possible to catch COVID from someone who has, for example, just a mild cough or does not feel well. Business Tech wrote an article in 2020 stating that the studies out of the University College of London have suggested that some severe problems occur in even mild cases of the infection, including brain damage and other neurological issues. The Business Tech article goes on to explain that researchers from the university assessed the neurological symptoms of 43 patients hospitalized in the United Kingdom with either confirmed or suspected COVID infection. They found that 10 cases had temporary brain dysfunction, 12 cases had brain inflammation, 8 cases had strokes, and 8 cases had nerve damage. From the above, we can establish that healthcare professionals are learning new things about the virus every day. Keeping yourself updated with the news is a vital cure in helping you not pick up the virus or to detect symptoms quickly that can relate to COVID-19. What to do if you are infected with the COVID-19 virus? According to the National Institute for Communicable Diseases, this information is for those who have tested positive with a laboratory result and those that live in households with someone who have been confirmed to have the coronavirus disease. A positive result means that your specimen was sent to the laboratory and your genetic material has been confirmed to have coronavirus. Once you have had your test, you will need to self-isolate at home until your test results are available. When your results arrive, and it is positive, you will need to further isolate for 10 days. The NCD goes on to explain that if you live with other people, as far as humanly possible, you should stay away in a separate sick room and away from other people in your household. If a sick room is not possible, try to keep to one area of your home, at least 2 meters, 3 steps, away from other people and wear a disposable face mask to prevent the spread of the virus. The virus is spread through droplets produced by coughing and sneezing around other people. Limited contact with any pets and animals. Cover your mouth and nose when you sneeze or cough with a disposable tissue. Dispose of the tissues into a waste bin in your sick room or area and then immediately wash your hands. Wash your hands regularly using soap and water for at least 20 seconds or use an alcohol-based sanitizer containing at least 60% alcohol. Clean your sick room or area every day. First, by using regular household soap, and then after rinsing, use regular household disinfectants containing a 0.5% sodium hypochlorite. Make this 1 part 5% bleach to 9 parts water. If someone else cleans your sick room or area, they should use protective equipment including single-use or utility gloves and a plastic apron while cleaning. If you have a home carer, your carer should adhere to home-based infection control recommendations, including the use of personal protective equipment. The NCD continues by explaining that you must not share eating utensils, towels, bedding with others in your household. If possible, use a separate bathroom. Clean and disinfect bathrooms at least once a day, the same way recommended when cleaning your sick room or area. Remember to discard single-use personal protective equipment. In the event that you have to share a bathroom, clean and disinfect the bathroom after every use. Your laundry, clothes, bed linen, and towels should be placed in a laundry bag. Do not shake soiled laundry to avoid spreading the virus through the air. Machine wash laundry at 60 to 90 degrees Celsius water with regular detergent. If machine wash is not possible, wash laundry using the regular laundry soap and hot water in a large container using a stick to stir. Hang washing outside to dry in the sunlight. Shared spaces should be well ventilated. If a fan is available, point it out one window and keep another window open to facilitate increased air exchange in the room. In the event that you share a kitchen, avoid using the kitchen at the same time as others. If possible, have your meals in a separate room and use separate utensils. If you have a dishwasher, use this to clean and dry your cutlery and crockery. If you do not have a dishwasher, wash crockery and cutlery using usual wash-up soap and warm water and dry thoroughly. Disposable face masks, single-use gloves, plastic aprons, disposable face tissues, and any other waste should be discarded in a waste bin with a lid in your separate room or area. The governments and health officials who are in contact with you will advise you on how to safely dispose of this waste. So what do you do if you are a person who has been in close contact with a person who is confirmed to have COVID-19? The National Institute for Communicable Diseases advises that people who are close contacts of a person who is confirmed COVID case to quarantine at home and to monitor their symptoms. So what does it mean to be a close contact? It means that you have been in close contact with someone who has been confirmed to have COVID-19, but you do not show any symptoms yourself. Close contact means that you have had face-to-face contact within a space less than 1 meter from the person, or you were in close space for more than 15 minutes with a person who has COVID and not wearing a face mask. The contact happened while the person with COVID was still infectious, which can be from 2 days before to 14 days after their symptoms begin. For example, you can be one of the following people: someone who lives in the same household as a person with COVID, someone who works closely in the same environment as a person with COVID, someone who sat in the same classroom as a person with COVID, attended the same gathering as a person with COVID, provided direct care for a person with COVID in a healthcare setting without using the proper personal protective equipment, someone who has sat within 2 seats, which is 1 meter, in any direction of another person who has COVID in any kind of vehicle, including buses, minibuses, taxis, and taxicabs, or has served as a crew member in a section of an aircraft where a person with COVID was seated. So, will you need to be tested for COVID if you are a close contact? The National Communicable Diseases Center explains that you will only need to go for a laboratory test if you develop symptoms within 14 days of your last contact with a person who has tested positive for COVID and who is considered to still be infectious and able to transmit the infection. Your close contacts will need to have a COVID test done if you are the first confirmed to have COVID and they start displaying symptoms. What does it mean if I have been asked to quarantine at home? As per the National Communicable Diseases Center, you will be asked to quarantine at home if you have been exposed to a person with COVID while they are still able to transmit infection, and if there is a possibility that you have been infected with COVID. By staying at home in quarantine, it will help to control the possible spread of the virus to your friends, relatives, and your wider community. Before we continue, let's first understand the difference between isolation and quarantine. Isolation means that you are separating an already sick person with a contagious disease from people who are not sick by either self-isolation at home or in a designated isolation facility. The period for isolation is as follows. If you are asymptomatic, meaning that you are not showing any symptoms, you must isolate for 10 days from the time of a positive test. If you have a mild disease, you must isolate 10 days from the onset of symptoms. With moderate to severe cases, a person must isolate for 10 days following clinical stability. People in isolation will need to be monitored closely. For worsening symptoms, the person will need to seek admission to a hospital or an isolation facility. Always refer to your medical practitioner for further advice. Quarantine is to separate and restrict the movement of people who were or may have been exposed to contagious diseases to see if they become sick, or they may have the disease but do not show symptoms. The recommended quarantine period for COVID exposure is 14 days from the time of exposure, close contact, or entering to the country. If a person remains well during the period of quarantine, they do not need to test during or at the end of the 14-day period. People discharged from quarantine or isolation after the recommended days should self-monitor for a further 10 days and report any development of symptoms to their doctor. So what must you do during quarantine? The National Communicable Diseases Center recommends that you stay at home. Do not go to school, do not go to work, and do not go to any public areas. You must inform your employer and let them know that you cannot come into work. Do not use any public transport, which is including buses, minibus taxis, and taxi cabs. Do not travel. You should cancel all your routine medical and dental appointments. If possible, you should not even go out to buy food, medicines, or other essentials. You should ask friends or relatives to go to buy groceries and essentials for you. If you have access to the internet, you can order your shopping or medications online, but tell your delivery drivers to leave any items for collection outside your house. Delivery drivers should not come into your house at all. You should not go outside to exercise unless you can maintain a safe distance from others in an outdoor space. It is recommended that you do it in the safety of your own garden. You should not have any visitors in your home during your quarantine period. Make sure to keep in touch with your relatives, friends, and colleagues over the phone, internet, or by using social media. The National Communicable Diseases Center explains that if you live with other people, you must, as far as humanly possible, stay in a separate room and follow the advice given in Unit 4 of this workshop. If you live with other people and you are able to physically stay apart from them, they can continue their usual activities outside of their home. If you are unable to stay apart from members of your household, they should quarantine for the same period as you. So, now that we have a better understanding of how the virus happened, what to do if you tested positive, what to do if you need to quarantine or self-isolate, let's have a look at how to treat COVID-19. According to the World Health Organization, to date, there are no specific vaccines or medicines for COVID-19. Treatments are under investigation and will be tested through clinical trials. Here we have two ways in which you can manage yourself when you have COVID-19. The first way is through self-care. If you feel sick, you should rest, drink plenty of fluids, and eat nutritious foods. Stay in a separate room from other family members and use a dedicated bathroom if possible. Clean and disinfect frequently touched areas. Everyone should keep a healthy lifestyle at home. Maintain a healthy diet, sleep, stay active, and make social contact with loved ones through the phone or internet. Children will need extra love and attention from adults during difficult times. Keep to regular routines and schedules as much as possible. It is normal to feel sad, stressed, or confused during a crisis. Talking to people you trust, such as friends and family, can help. If you feel overwhelmed, talk to a healthcare worker or professional. The second way is to use medical treatments. If you have mild symptoms and you are otherwise healthy, self-isolate and contact your medical provider, or call the COVID hotline number on 0800 029 999. Seek immediate medical care if you have a fever, cough, difficulty breathing. Make sure that you call your medical practitioner in advance. While some Western, traditional, or home remedies may provide comfort and alleviate symptoms of mild COVID-19 symptoms, there are no medicines that have been shown to prevent or cure the disease. The World Health Organization does not recommend self-medication with any medicines, including antibiotics, as a prevention or cure for COVID-19. However, there are several ongoing clinical trials of both Western and traditional medicines. The World Health Organization is coordinating efforts to develop vaccines and medicines to prevent and treat COVID-19 and will continue to provide updated information as soon as research becomes available. Let's look at some ways of preventing COVID-19. The World Health Organization recommends that the most effective ways to protect yourself and others against COVID-19 are to do the following. Always wear your cloth face mask when going into public areas and when you are in contact with people. The mask must always cover your nose and mouth. The face cloth masks will help in preventing the droplets from a person when speaking, coughing, or sneezing to spread to others. Regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water. Washing your hands with soap and water or using alcohol-based hand rubs kills viruses that may be on your hands. Always maintain at least a 1.5 meter social distance between yourself and others. When someone coughs, sneezes, or speaks, they spray small liquid droplets from their nose or mouth which may contain the virus. If you are too close, you can breathe in the droplets, including the COVID-19 virus if a person has the disease. Avoid going into crowded places. Where coming in together in crowds, you are more likely to come into close contact with someone who has got COVID-19, and it is much more difficult to maintain a social distance of 1.5 meters. Avoid touching your eyes, nose, or mouth. Hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose, or mouth. From there, the virus can enter your body and infect you. Make sure you and the people around you follow good respiratory hygiene. This means covering your nose and mouth and with a bent elbow or tissue when coughing and sneezing. Then dispose of the used tissue immediately and wash your hands. By following good respiratory hygiene, you protect the people around you from viruses such as colds, flus, and COVID-19. Stay at home and self-isolate even with minor symptoms such as cough, headache, mild fever until you recover. Have someone bring you supplies. If you need to leave your house, wear your mask to avoid infecting others. Avoid contact with others will protect them from possibly contracting the COVID-19 virus and other viruses. If you have a fever, cough, and difficulty breathing, seek immediate medical attention, but call by telephone in advance if possible and follow the directions from our local health authorities. National and local authorities will have the most up-to-date information on the situation in your area. Calling in advance will allow your healthcare provider to quickly direct you to the right healthcare facility. This will also protect you and help prevent the spread of viruses and other infections. Keep up to date with the latest information from trusted sources, such as the World Health Organization and from your local and national health authorities. Local and national authorities are best placed to be advised on what people in your area should be doing to protect themselves. Let's look at the safe use of alcohol-based hand sanitizers. To protect yourself and others against COVID-19, clean your hands frequently and thoroughly. Use alcohol-based hand sanitizer or wash your hands with soap and water. In the event that you use an alcohol-based hand sanitizer, make sure that you use and store it correctly. Keep the alcohol-based hand sanitizer out of children's reach. Teach them how to apply hand sanitizer and monitor its use. Apply only a coin-sized amount on your hands. There is no need to use a large amount of the product. Avoid touching your eyes, mouth, and nose immediately after using an alcohol-based hand sanitizer, as it can cause irritation. Hand sanitizers recommended to protect against COVID-19 are alcohol-based and therefore can be flammable. Do not use before handling a fire or cooking. Under no circumstances, drink or let children swallow an alcohol-based hand sanitizer. It can be poisonous. Remember that washing your hands with soap and water is also effective against COVID-19. In conclusion, we are still learning about COVID every day, and as we have seen, things can change drastically and quickly. What we have covered today is only the basics, and there is so much more information to speak about. But by following these basic guidelines, it will assist you in preventing the spread of COVID as well as guiding you on what to do if you or others have tested positive for COVID-19. COVID affects everyone, whether you are a young or old, male or female, and irrespective of what the color of your skin is. Do not discriminate against anyone with the virus. Instead, provide them with care and support that they will need to get them through a difficult time. You may contract the virus, and you may want that from other people, so be considerate. Thank you for taking part in my workshop. Please Please look after yourselves and keep safe. Thank you.